many patients who have blockages in their heart arteries, they don't know they have them until later in the case where the blockages become so big or so tight that you start to have symptoms. And there are many people who are not so fortunate, if you will, where the first time they know about it is when they come in with a heart attack. The test we're talking about here, this calcium scoring test, is a very non-invasive test. We're very fortunate to have it here in the Wabash Valley, especially at Union Hospital Clinton, where it's offered for only $49, cheaper than any test you do. What the purpose of the test is to detect calcium deposits in the heart arteries. The presence of calcium deposit reflects that there's a plaque buildup. When the plaques start, the plaques are made essentially from cholesterol and fat and what have you. Then later on, as time goes on, calcium gets deposited in these plaques. So when we see calcium in the arteries of the heart, it tells us there is a plaque behind it. Especially those who have family history, for example, or they have high blood pressure, or they have diabetes, or they're a smoker, but they don't have symptoms. And where the indication for medication is on the borderline for them, if they have the scan and we see calcium, seeing is believing. When you show the blockage or the calcium in the arteries to the patients, they'll be more motivated to doing something about it as well as their physicians. It is those people who don't have symptoms where the test is very, very valuable to tell them where they stand. That's why you have people, the first time they know how they have heart trouble is what? When they have sudden death. Half of the heart attacks happen sudden death is the first manifestation. It's very unfortunate. Those who have moderate, what we call the moderate risk of having heart attack, especially in their 40s to 70s to 80s, those are the ideal patient to have it. They should not, those who do not have symptoms, of course. If you have symptoms or if you have multiple risk factors where there's so many red flags all over with your history, the test is not going to add to it. And those who have very low risk, you don't have any symptoms and you don't have any risk factors for heart disease. You can name them, for example, there's no blood pressure, there's no diabetes, you don't smoke, there's no family history. I mean, those ones, especially the young, it's unlikely that the test would be helpful in this situation. Those, and that is the question, who should not have this test, or who this test is not for them? If you already had a heart attack, if you had a stent, you've had bypass surgery, and I mean, we know that you have a problem, it's not going to add to us information. So those who are in the middle range, which are the majority of people, and that's why the advantage of the test, to prevent you from sudden death. Those who do not have symptoms, they do not know they have something brewing in their heart arteries. And as I said earlier, the very unfortunate thing is the first time we realize it is sudden death. There is very minimal risk. As you can see, it's an X-ray. So there is radiation exposure, but it's very, very minimal. The amount of radiation you get from this is equivalent to having a mammogram. So it's not really relevant in this situation.